Basically, you can do anything you want. Nothing is supported by the literature in this. It's really just by Steve Haddad telling us some things. So, meta-analysis, looking at a bunch of different total ankle articles, it's not possible to provide sufficiently supported evidence-based recommendations for any of these postoperative things. So I think you just kind of have to be consistent in what you're doing and kind of reevaluate every once in a while and then change as needed. But I'm going to break it down into kind of post-op and through the first 2 weeks, what we do in the OR, what we do in the perioperative period. Then for the next 14 to 90 days, how we're treating them after that, and then kind of long-term after that. So first off on regional blocks, whether you do a one-time block or a continuous block, the literature supports either one. The one thing I'd just caution with is the blocks have rebound pain, so they may have great relief in that 24 hours to get a big increase in pain. Articles have shown 5% short-term problems and then up to 1% long-term problems. The anesthesiologists generally think everyone does great. When they have a problem, they are not the ones who are around to take care of them, so it's all you, and a lot of them it's nothing you can take care of. So at least make sure the patients know that they can get some long-term and even sometimes permanent problems from the blocks. Many articles, this one specifically, Foot and Ankle 2022, they were way higher. They said even at 2 weeks, up to 40% of people had neuropathic symptoms. And those are the things that patients just think is normal, and then a month or two later, they'll mention that they have numbness on the bottom of their foot or somewhere else, totally away from where you made your incision. Then you realize they've had a block injury. So single versus a continuous block, literature supports either way.